Good morning, everyone. Welcome, welcome. We will give it a few more minutes as people join us, but welcome. Good morning. Welcome to everyone joining us today. Thank you very much for giving us your time this morning. We appreciate it. Hopefully, everyone has been having a good session. I know that we are very early in the nonprofit driven conference, but hopefully, it's been great for everyone so far. We'll give it a few more minutes as people join here. Hey, all right. Thank you, everybody. I will start off by introducing myself. My name is Sania Dure. I am a member of ONN's Policy Committee, and I have the privilege of moderating this conversation today and being in conversation with some folks who are really phenomenal and doing great work. I think it'll be a great session. We look forward to also getting your feedback once we get going in questions in the chat, and we will have some time for a question and answer session at the end. But before we get going, I did want to begin with a land acknowledgement of just where we are today. So we are meeting today on the traditional and unceded lands of Indigenous people. All the speakers in this panel are located in what is currently called Ontario, on the traditional territories of the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat. We honor Indigenous people as keepers of these lands and recognize the impact of the ongoing colonial project on their ways of life. Those of us who are not Indigenous locate ourselves on these lands as treaty people, particularly in a year that has shown more than ever the need to look at the harm that's happened here. We've spent a year watching as the graves of thousands of children have been uncovered in residential schools across Turtle Island. We hope that everyone who's participating in these sessions today will take a minute to recognize and to honor their role in upholding treaties and standing in solidarity with Indigenous peoples. Okay, thank you very much. So, as mentioned before, I would like to introduce you to our session today, which is called The Role of Community Organizations in Times of Crisis. The session really explores what community organizations have been doing through the pandemic and the ways that they have responded to the need that has come up. So I will briefly read here our description before we get going with the actual session itself. During the pandemic, individuals, neighbors, and community organizations work together to take care of their communities. We have some feedback there. I will just wait for a second. I will ask folks if you can mute your mics. If you are joining the session, please mute your mics. That will just help us to be able to move forward in a bit of a better way. So going back to what I was saying about the session, community organizations stepped up and acted decisively to address gaps in response through this ongoing pandemic. So they provided everything from shelter, food, offering mental health supports, addressing the ongoing and worsening overdose crisis. They also played a significant role in the vaccination rollout. They played a role in testing when the pandemic was still in its early days. And many of these organizations continue to do this work. So even as we start heading to vaccination of younger children, they are still doing this work. They're still responding to the fallout from the pandemic. So still responding to things like food insecurity, to ongoing social inequities that have developed. Community organizations continue to be really important players. All through this, they've also advocated for more nimble funding, and they have provided their on-the-ground experience and expertise, both to local bodies, to government bodies, to other decision makers. So the purpose of this panel, we really wanted to explore what community organizations have done over the pandemic. We wanted to explore the learnings, to discuss how in the future community organizations can collaborate more effectively. And then we wanted to see what lessons we could draw from there to build a stronger and more resilient sector moving forward, knowing that pandemics like this or other crises like this will be inevitable. So we have three speakers with us today. Amol Gill, who is with the Punjabi Community Health Services, Gurpreet Malhotra, who is with Indus Community Services, and Michael Allen, who is with the United Way East Ontario. So all of you should have seen their bios in the conference panel. So I will not spend a lot of time talking about their bios, as you can go and read them. But I will say that I will ask our speakers to also maybe just introduce a little bit about themselves as they get going. I am going to hand over to the first of our speakers, who is Gurpreet. Thank you so much for being here with us, Gurpreet. Gurpreet is going to brings a wealth of experience in strategic policy and planning. And he's going to walk us through the context that community organizations started the pandemic in. He's going to set the scene for us and talk about what enabled our work. And then he's also going to talk about what policy interventions and strategies made our work possible as organizations in the nonprofit sector. So thank you so much for being with us today, Gurpreet. Over to you.
Thank you so much. That was a wonderful introduction. Gurpreet Malhotra, I'm the CEO of Indus Community Services. It's a multicultural, multi-service agency based in Mississauga with locations in Mississauga, Brampton, and Oakville. Settlement agency, as well as serving seniors with frailties and a family counseling wing to boot. So I'm very, very pleased to be here and to be part of the panel. Thank you, Sani.
Thank you.
Would you like me to go right into the piece, or do you want to have each introduce themselves?
Well, since you've taken a pause, I think let's have everyone introduce themselves so people know whose faces they're looking at. Amol, why don't you go ahead and introduce you? Why don't you go ahead and introduce yourself?
Thank you so much, Sani, and thank you to the ONN for having me today. My name is Amol Gill. I work as the program coordinator at Punjabi Community Health Services, or PCHS, which is a health and social services organization focusing on the South Asian community based out of Brampton, with offices, again, across a region of Peel. Again, geriatrics, mental health, addictions, settlement, and many supports and services. But my role in particular, I've been working on the high priorities community strategy. So doing COVID-19 work for the past year with PCHS, and excited to speak about it today.
Thank you. We're excited to hear about it. Michael, if you would mind introducing yourself.
Of course, and thank you, Sani, and welcome to my co-panelists. We had an opportunity to meet each other for the first time last week, and it'll be, I'm looking forward to our conversation today. My name is Michael Allen, as has been introduced. I'm the president and CEO of the United Way of East Ontario. For us, East Ontario comprises the city of Ottawa, the counties of Lanark and Renfrew, and the region of Prescott-Russell. So we have a significant geography that spans, an incredibly large portion of our province. In some cases, a very dense urban setting for the city, and in some cases, a very sparsely and widely distributed population. So different challenges that were presented in the pandemic that we'll talk about a little bit today, and the role that we played. While I have the opportunity, I will, for our guests today, introduce three of my colleagues who are part of the audience, but will help us animate some of the chat information. Preeti Prabhu is our Director of Government Relations. I'll portray a slide up when it's my turn. Cameron Ketchum is our Director of Community Impact, but I described him as the quarterback of one of our initiatives, which was a large collaborative role that we played in the pandemic, the Community Response Table for COVID-19, and Britt Vernon, who is our office manager and supports my work directly. So that's Sani, back to you, and thank you for this opportunity to contribute to the conversation.
Thank you. I vaguely understand what a quarterback means. I'm going to plead that I'm an immigrant who didn't grow up here, so I don't know what these sports terms are, but vaguely.
How about a midfielder?
Okay, yeah, I understand that. I understand that. Okay, well, thank you so much. Gurpreet, we will hand over to you.
Terrific, thank you, and it's wonderful to be with such an impressive panel. What I'm going to do is, in regards to the role of the community organization in a crisis, is focus on working on a more systemic level and through a policy lens. I'm going to talk a little bit about the environment or systems that you can use to influence each other, as well as collective action. And if I have a little bit of time, I'll also talk about the issues around what policy pieces are missing and where we have difficulties. So first, using one system or environment to influence another. Community agencies have the benefit of being able to do this, and it did become one of our main roles to do. As far as having one system impact another, the example was actually our United Way funder. We're funded by the United Way of Greater Toronto, and in the early days of the pandemic, they told us that, look, you know what, you can go ahead and support the community in whatever way you see as best. And as an organization that's doing a large number of different things, that allowed us a lot of flexibility. But what it really allowed us to do was take that answer and be able to transfer it to other funders. So then we were able to impress upon them the trust that was being demonstrated to us and that they needed to do the same. And then we very quickly saw other organizations, other funders do the same thing. So that was being able to use one to leverage the other. Tied into that was the fact that planning tables cropped up in Ottawa, in New York region, and in Toronto, and very early in the pandemic, and Peel followed. We were able to use Ontario for All and what they had begun to do in New York and in Toronto, and asked Peel region if they'd do the same. So this gave rise to three meetings a week. The community response table. It met for about an hour, 3 times a week, and at one point had 400 different attendees on there. That was community agencies, the various departments, government, those providing health and social services, faith groups, interested individuals. I'll never forget one person coming on screen saying that they had a skid of chicken to donate, and how could that work through? And so from details like that through to the necessity to make sure that they were collecting race-based data and reinforcing that we needed to see that data really helped move things forward. So one leverage led to another leverage, led to more. The community response table still meets now once every 2 weeks and has always the capacity to meet more frequently if it needs to. But what it did do was spawn, if you will, the next part of what a community agency can do, and that is focus on collective action. So the community response table became a place that people built trust fairly quickly. Many agencies already knew each other. Many faith groups had already worked or interacted with each other, and many levels of government had already gotten a sense of what was going on with each other, and were participating as we were making things happen in Peel, because we were particularly hard hit. The hardest hit in the province. So the second part of second pandemic hit, and that was anti-Black racism and systemic discrimination, as evidenced through the horrible murder of George Floyd. And so Peel gave rise to the anti-Black racism and systemic discrimination table. And so it began to meet. And then we discovered that there were other things that we could divide up and focus on and fine tune. One of them was around police advocacy, another was around health equity, and the third was around education. Around police advocacy, there were several activities around problems that the community was having with the police, and difficulty the police was recognizing in and of its own structure. So I'm super proud to point out that Peel Regional Police is working hand in hand with the Ontario Human Rights Commission to focus on its own internal racism or perceptions of racism and systemic discrimination, and is working with the community to help dismantle this. There's a lot to do, but the work has started, and that came from collective action. On the health equity side, it became clear as we insisted on race-based data that the South Asian communities, the Black and Afro-Caribbean communities, Middle Eastern communities were all disproportionately more impacted by COVID than were all the other communities. And so there was a significant concern as to how to do this. So myself and Buldev Mutta from PCHS, the organization Anmol is coming from, both advocated to the Health, Ontario Health, which was coming online, the remnants of the LINs, if you will, as well as to the ministry and the staff that we had access to, and through the media, in order to raise concerns around how community agencies could respond. And that was pitched strongly in the summer of 2020, continued with media and other kinds of support for the months that followed. And in December, we were told that it's coming, and the high priority community strategy would be rolled out. And it was rolled out, and it was rolled out to 15 agencies. None of those agencies were specifically Black-led, Black focused. So we had a secondary piece of advocacy, and then we were able to support Roots Community Services in Peel as joining us as a full partner. So then it grew to 16 agencies, 6 of which are located in Peel, and the other 10 in Toronto, Ottawa, and other high priority areas where we were able to target our communications, in our case, jointly develop a upnahealth.org website that dispelled myths, boosted confidence, increased access to testing, as well as being able to give people a chance to vent their concerns, share their fears, and hopefully address them. So the high priority community strategy came in part from health equity concerns, that came from the anti-Black racism and systemic discrimination table, that came from the CRT, that came from a will of organizations to work together. So you see in each of these pieces that we have had multiple roles to play. Outstanding policy considerations tie actually back into that HPCS example, and that has been the lag in funding. The program, we were told of the program in December, funding and funding letters did not arrive till the end of January and had to be used by the end of March. That doesn't work. And of course, it takes time, as all of you know, to onboard people, to build a program of community health ambassadors for them to do their great work. The letter to start April for the new fiscal year didn't arrive till May. The letter and the program ended in September 30th, but we were told would continue, and we still don't have funding letters. So even though we're recognized as an emergency response to COVID under a program called High Priority Communities, policy around accounting and Ontario Health's and the Ministry of Health's processes in flowing out paperwork do not fit well with an emergency, speedy, timely response. And so and we're waiting, all of us across the province, any day now for us to receive a funding letter. But that is a sign of more work to do. And by me telling you this, in a way, I'm calling for our collective advocacy. Thank you. And I look forward to the Q&A that we will have in just a short bit. Thank you.
Thank you so much, Gurpreet. So I have been taking notes here. I would encourage folks as well. We will have a Q&A, but if questions are coming up for you, please also feel free to pop those in the chat. So Gurpreet, I heard 3 things from you that enabled your work. So first of all, you said that community organizations played a role in convening tables. So they brought people together to say, this is the issue, this is what is impacting people, what can we do to respond to that? Secondly, you said that there was collective action. community organizations advocated for focus on particular things. They were responsive to what was going on the ground and saying that we need an intervention that will look in certain ways. And then the third thing is that you said that they actually influenced strategy, the province's response to the pandemic, and that they played a big role in the development of things such as the high priority strategy. So for folks who may not be as familiar, the high priority strategy was introduced during the pandemic, and it was partly in recognition to the inequities that had developed over COVID. So as Gurpreet mentioned, that Peel was a region that had been particularly hard hit. There were other regions experiencing the same thing in the province. And the high priority strategy really said, how do we introduce things that will enable or that will reduce these gaps that are developing? So I hope that is a fair assessment, Gurpreet, of the 3 points that you've raised there. We're now going to go to Amol, who is actually going to talk to us about what it looked like on the ground, and to talk about what it was like to actually be working in these organizations, and then to take the things that had been introduced as strategy, but when you're implementing them on the ground. I will say one more thing, Gurpreet, you raised some great points about policy. We're going to put that in the parking lot to talk about what else enables our work. So we'll come back to that once we've talked to Amol and Michael. Amol, we'll hand over to you.
Awesome. Thank you, Gurpreet, for sharing. It's always a pleasure to hear what you have to share, and I've had the opportunity to do so through many meetings in this project, but I think your advocacy work is always comes without filters, but also speaks to the true realities of our community. And I think it's inspirational for myself, and I think for an incoming generation of community health workers. So I just wanted to say thank you for that. And so while Gurpreet has spoken a little bit about the higher level or policy considerations for this work, in my role as a program coordinator, I've been working on the ground. And so during my next 10 minutes, I hope to share with you a little bit more about the work that we did through this high priorities community strategy, what worked well, what didn't, and really what we've learned so far throughout this project. And so as Sane mentioned, the high priorities community strategy saw the Ontario government provide funding to local lead agencies, Indus and PCHS being two of them, and to deliver key interventions in Ontario's hardest hit neighborhoods, and to do so through collaboration with health units and other community partners as well. And I think really the strategy sought to support members of racially diverse newcomer and low-income communities who faced additional and often very complex barriers to accessing COVID-19 supports. I think it really came out of the advocacy work that Gurpreet mentioned that really highlighted the gaps that were left behind by the province's one-size-fits-most COVID-19 policies, and really understanding that there was expertise that lies outside of just the government and expertise that lies with community agencies who were able to come up with often very creative and very hyper-local strategies and responses. So this high priority community strategy really operated under 3 pillars, that being increasing access to testing, so ensuring people know where to go to get tested, providing transportation, knowing how to access your results. The other pillar being community outreach and education, so really ensuring that culturally appropriate communication was shared on the correct information channels that were being accessed by community members, so not just social media or government websites. And then also wraparound supports and services, so ensuring that once an individual leaves a testing center, that they're actually able to safely isolate, and they have the resources and financial aid, hot meals, money for hygiene products, connection to isolation hotels, childcare, whatever supports and services that they really need to safely isolate and make sure that they have food on the table and money for rent as well. So the work that we did on the ground really evolved as the pandemic evolved, and consequently as community needs evolved. So at the beginning of the project, a lot of the work really focused on sharing the importance of masking, of social distancing, of testing, and really focusing on making sure that these resources were translated and available in community members' native languages, which at the time you could not find on any government website. At the beginning, a lot of the work also involved working at testing centers and making sure that individuals in a community that often lives in multi-generational homes, or international students and newcomers that live in very dense housing conditions, knew, hey, there are isolation centers that you can go to that provide meals that are culturally appropriate and that you can access without any cost. And at the beginning, a lot of our work also focused on working with essential worker communities. so who are facing the brunt of the COVID-19 pandemic. So workers with lower wages, working with little to no like sick leave or protection, little to no job security, and a community where food insecurity and housing insecurity were acute, but COVID was only one of the many hazards that they faced on a daily basis. So a lot of our work in the beginning of the pandemic, beginning of this project, focused on working with logistics and manufacturing organizations, getting in and speaking to workers and letting them know about the supports that were there to help them. And I think in the middle, as vaccine approval came around, the project again shifted now to supporting community conversations, whether that be one-on-one with a health ambassador and a community member, whether that be going into a group session with seniors and having a conversation, or whether that be webinars that are hosted by South Asian doctors in South Asian languages and broadcast on South Asian media channels, where the reach was beyond social media and really to build trust and help people feel confident in their choice to get vaccinated. That was a really big focus there, again, as Gurpreet mentioned, through Upna Health, to dispel myths and dispel misinformation and make sure that that information was available in their languages that are spoken in the community. So whether that be Bangla, Urdu, Tamil, Hindi, Farsi, among many others. And then I think shifting on through the project, the shift quickly focused now as vaccinations became available to community members, not just supporting them in how do you book an appointment if you don't have a health card, or how do you who do you ask medical questions to when you don't have a family doctor, to really working with regional partners. So with the region of Peel to host some very hyper local and low barrier vaccination clinics that were shaped by community insight. So community insight on what's the best location that's as easily accessible, what hours work well, really early morning, late at night, what languages, what registration process, how do we break down any of those barriers to make these vaccinations accessible. And so I wanted to highlight two clinics that Indus and PCHS and the Region of Peel and many other partners worked on. And I think one being the South Fletcher's clinic that we ran beginning of May. So this was, take it back to a time when the only way you can get a vaccine appointment was through like a viral link that would go on and would get booked within a minute, right? And the thought process and the goal with this clinic was really to do outreach, to make the vaccination available to essential workers, to immigrants, to individuals living in multi-generational households who weren't on social media, who weren't on Twitter, who weren't able to like book a vaccination appointment through the click of a button and through the province's first come first serve basis or portal. And so the outreach for this clinic, I think, really had us getting creative, to going to gas stations, going to McDonald's, to Fortino's, to frontline Indian restaurants, to bus terminals, to bring the vaccination to individuals and to bring the registration to individuals and not put the burden on folks to further now navigate a very tricky system that wasn't easy and often had many barriers and roadblocks along the way. The second clinic that we helped run was the Sheridan Community Clinic, which ran from the end of May to the beginning of June, end of July, sorry. So 55 clinic days over the course of 3 months and 35,000 vaccinations, which is an amazing amount. But I think really what that clinic came out was from community insights that, hey, international students, visitors, individuals on visas are having a very hard time booking, and the system is not set up to support individuals from getting vaccinated due to, again, many roadblocks being set up. So I think the thought process there was putting together a low barrier clinic. No health cards are required. It's open to international students. You can walk in. It's easily accessible by bus. And I think really, again, the focus here for our agencies was being unique in our outreach. So bus terminals, partnering with local tiffin and meal delivery services to share flyers, in meals that were often delivered to international students and essential workers. So I think the theme across a lot of the work that we did, and now we continue to do, looking forward to 5 to 11 and third doses, is really being unique in our outreach and making sure that we're bringing information and vaccination to the individuals and not putting the burden on individuals to now go navigate a very tricky system. So what worked really well, I think, as Gurpreet mentioned, I think maximizing our reach through partnerships. So PCHS and Indus were 2 of 6 agencies in Peel, and while we were doing similar work and it was different agencies, when we went out to do the work, it was one big team. And there's a lot of sharing here about what worked well, what didn't work well, insights that we're hearing from the community, what are mistakes that maybe one agency made that the other shouldn't. And I think that really helped us streamline our efforts and make sure that there was that the work that we were doing, the resources were being used to their full potential. I think otherwise also partnerships with community partners. So testing centers, Region of Peel, Sheridan, I think really were beneficial here to maximizing our reach. I think what also really worked well was being able to quickly pivot our strategy in response to real-time information from the community. So on the ground intel that our community ambassadors would get, being dynamic in our response. And what really allowed for that was, again, like nimble funding from the government. I think, yes, we had our 3 pillars, and yes, we knew that what the outcomes were, but there wasn't a very rigid and prescriptive approach to how communities, agencies were able to do that work. So allowing for that allowed us to work nimbly, work proactively, and really work collaboratively across agencies to support community members in ways that we initially thought they would need support, but also in ways that came up as the project went along. What didn't work well, or what were some lessons that we learned? I think looking forward, the project came out of an understanding that certain communities were hit harder by COVID, and that through this project, we were able to maybe break down some of the barriers when it came to access to testing, isolation, or vaccines. However, through community conversations, it's very evident that there's a need for support beyond just when an individual is infected or getting vaccinated. So now agencies are facing capacity issues and supporting clients beyond COVID. And in Peel, we see, need for housing, or an exacerbated like housing insecurity, food insecurity, and also a surge in demand for culturally appropriate mental health, addiction, and geriatric supports. And there's a difficulty in referring clients to these culturally appropriate supports once they're no longer in your care due to a massive gap in regular programming that's already existing due to COVID. Another thing I think that was missing, and Gurpreet already mentioned this, but and I know has been a champion throughout, was collection of race-based and sociodemographic data. I think that really would have helped. Yes, it's important in understanding who is being infected, but now on a ground level, when we're in the last mile strategy of understanding who remains to get vaccinated and how do we streamline our supports to make sure that our resources are being used and our strategies are very hyper-focused. Knowing who hasn't yet been vaccinated would have been I think a great tool for not only funders, for system partners, but also for agencies, and to be able to rely on data aside from just community insights and conversations, I think really would have been monumental in making sure that the project is as beneficial as it could have been. And lastly, I think my last point, and just moving forward, I think when we look at the system currently, public health agencies and units don't have staff on the ground that are doing the critical work of community health ambassadors, the ear to the ground or that community insight. So really for us on the ground level is looking forward is how do we work together past March to ensure that this model can be utilized for longer haul concerns facing the community. So diabetes prevention, chronic disease prevention, cancer screening, connection to primary care. So on a ground level, really that's what we're looking at is how do we integrate public health units and community agencies through this community ambassador model. So yeah, so I know I shared a lot, but I wanted to say thank you again, and on to Michael, I think, to take on the next session.
Yes, that was very rich. Thank you so much. Thank you so much, Amol. Before we go to Michael, I will just summarize very quickly just some of your top points here. So you talked a lot about maximizing partnerships, collaboration between teams, and that issue of on-the-ground intel and being able to pivot and being nimble. I think when we come back to the question period, we maybe would like to talk a bit more about this community trust and why that is such an important part of the work that we do as nonprofit organizations, how it enables our work. But let's for now go to Michael, and then we'll come back to that with our questions. Michael, over to you. Oh, you're muted, Michael. We can't hear you.
I know.
There you go. We should be able to hear you now. I see your screen light up.
I don't think you can hear me, can you?
Now we can. Now we can.
Okay. For some reason, my screen is not profiling it. But anyways, thank you. Something technology is hurting me. Listen, that was. I'll confess to you, my fellow panelists, that when we had our session last week, it wasn't very clear to me how this was all going to go, and I want to tell you how much I appreciated your comments, because now I have a sense much better about what I hope we're able to offer to the audience today. And so Amal, the information that you provided about the experience on the ground is something that we cannot offer from a United Way perspective. We hear about it, but hearing it from you, first of all, resonates very deeply with us because we heard lots of that kind of thing. But it's important to understand the experience that you had. And Gurpreet, I'm not sure I've had someone who participated in the same way that we had hundreds of people participate at our own community response table, which is exactly the name that we had for it. So we want to speak about copyright infringement, but nevertheless, the perspectives that you offered were very insightful. What I will try and contribute today, and again, I mentioned if Britt can start our slideshow, is that Cameron Ketchum, who was our midfielder or our quarterback for our community response table, Preeti, who was responsible for government relations, and Britt will run this. And so I'll provide their contact information. But let me first step back and offer to you, in the same way that both Amal and Gurpreet have done, what I would characterize as some of the attributes that we witnessed, that we lived through during the pandemic. And so I'm not sure, is that slide up? Britt, are you able to have that slide up?
Yes, it's up, Michael.
Okay, I'm sorry, my screen, I must be behind for some reason, so I can't see it. So in any event, thank you for that. So as was mentioned, and we will very much echo this, that the community sector was able to respond in a much more rapid and nimble response fashion than governments did. I'm going to often contrast this with governments, not in any way to diminish the contribution of government, but nevertheless to contrast it. And so United Way and the agencies that we convened around the issues that you spoke of today, and many, many others, were absolutely on the job. I would estimate probably 6 months before government showed up with funding. And I say that again, not to be in any way critical, but in a way to suggest that the crisis that was presented by the pandemic was something that required our urgent response, and that only people on the ground, embedded in community, in touch with their clients, were able to respond effectively. And it wasn't in any way, as I say, that government wasn't appreciated. Thank God they were there later on because the pandemic demanded it. But if it were not for the capacity of the sector to get their act together and take care of some of those urgent, pressing, basic needs like food, like medicine, like isolation, mental health, and other issues, addictions issues came later and will prevail for some time, but those were very significant. As well, as Amal suggested, we were able to, and I say we, and I'm speaking now collectively, not just United Way, but as a table, we were able to calibrate much more precisely at a local needs and circumstances level. And so what was needed in one community, and this is particularly so in the context of a region like ours in East Ontario, where the challenges in the city were not the same as the challenges in parts of the rural area. In parts of the rural area, one of the things that came so dramatically to light is that many isolated seniors who were separated by great distance, had no reasonable means of transportation, were forgotten. If it wasn't for a neighbor, if it wasn't for an agency, if it wasn't for an organization that was able to step up, they would have been forgotten. Many of them would have starved because many do not reach out and ask for help because they're too proud, and they would have been lost. And so one of the early pieces of feedback that we had will illustrate this. But again, governments are not good at this. They're not good at reaching deep into the individual circumstances of people who are left isolated and alone in a crisis like this. And so I want to just play you a piece of feedback that we got through an agency we funded, much like Amal's, and they just provided this, and it just describes the human touch that this community sector was able to provide. So can I ask you to play that for us, Brett?
Good afternoon. This message is for Jean and just you folks in general. I have to say I'm overwhelmed with the delivery of food today on Wednesday afternoon. Fellow dropped it off here when we chatted for a moment. He was very nice. You folks are also nice. I'm so pleased. I looked at some of the foods and there's some wonderful ones, spaghetti, lasagna, beef stroganoff, and soups, minestrone. And tonight I found you have left me a favorite, a steak and mushroom pie. Oh my gosh. I will have that one. I will cook that one up for this evening's meal, for dinner, for supper. Yeah. Oh, you folks, I can't thank everything you've done. I can't thank you enough. Thank you ever so much. I'm so grateful. I hope you're all well and you're doing an amazing service for this community. We all appreciate everything that you're doing and have done in the past. Yeah. Okay, I better shut up. Okay, bye for now. Love you all. Bye for now.
So I'm sorry for that. I wanted to share that because I can tell you that it really lifted our souls and our spirits when we got messages like that. Because what you'll hear in John's voice, of course, is that there were people that cared for him, people who knew him, and a government cannot do that. This is the work of the community sector and neighbors and friends who are organized and have the capacity to support. And so that is a role that the community sector played. Likewise, if I just go back to this, to the attributes that we presented and learned over the course of the pandemic, we also, as is indicated by John's story, we took a very client-centric and a proactive response. So again, long before government showed up, we knew that John needed steak and kidney pie. I'm kidding, of course, but people knew about the challenges that their clients were facing, and we could anticipate them and inform government. Those insights that you spoke of, Amal, are the exact same insights that we experienced on a full range of issues. And then again, adding to the points that you guys have raised, we also recognize that particularly during the pandemic, and I'll come back to this in terms of the lessons, we sought out and realized and reaped the benefits of incredible nimbleness, innovation, and collaboration with a problem-solving orientation. Cameron will put in the chat perhaps some experience that he witnessed when we worked with other levels of government, municipal, provincial, federal. And you'll know this, that they offer programs. They don't offer necessarily a real-time problem-solving orientation. They offer typically money. Again, a very valuable asset and resource, sometimes late, sometimes not insufficient. But the community sector was able to offer other things, like a pallet of chicken, like some technology, like cell phones and computers to help kids who didn't have that capability or didn't have those tools to be able to keep up with their school. So we were able to draw on all sorts of things, including donors' contributions of resources to get out early. So the next slide just gives you a sense of the United Way of East Ontario's COVID response table, the CRT, Dupreet, as you mentioned it. We met probably 25 times over the course of about 15 months of our work. We regularly had over 100 partners meet with us. We drew upon another additional 80 subject matter experts, many from the sector, but many outside the sector as well. We had 60 plus responses, Every one of them designed to solve a problem, every one designed to address clients' needs. And we did that all in the space of a very few months. I'm going to just put up a slide now, Brett, thank you. These are the issues that we spoke about. I'm not going to go into every one of them, but I recognize that the range of issues that we dealt with are probably similar than the range of issues that other communities have dealt with. So issues around community needs and our responses and our approach to it involving government. A real issue that was hidden for a while from our field of view, but we dealt with and responded early, was what was happening to those that were now stuck at home dealing with violence in the home and unsafe isolation. And so again, we found solutions for that. And so there's a long list of things that we dealt with, we drew some lessons along the way. And the question then became, and I'll finish with this, with some lessons, is what does that look like now as we turn our minds to the post-pandemic priorities? And so we sat with the community response table, we sat with government, and we identified those things. I was at, for those of you who were at the opening plenary, Senator Omnivar said, when you speak to government, make sure you have an ask. And so we spent some time as a sector and actually across the country with other United Ways around what are the issues that in our communities are the most pressing issues that involve for us usually social justice dimensions and issues that are a remnant of the effects of the pandemic. Many of those things, of course, were issues prior to the pandemic, and the pandemic just exacerbated them. But nevertheless, for us, they fell into our three categories. So forgive this slide and its animation. I'll let Britt go at it. But they included basic needs like food and shelter. They included the academic achievement loss, particularly for those who are most vulnerable. Mental health and crisis supports. The sector, of course, we're talking about that today, particularly seniors and caregivers. And then we recognize that we are going to be moving into a period of time where economic recovery is critical. But we recognize as well that that provides us opportunities to address some of the social justice issues, the exclusion issues, the equity issues that we believe that we can address in the context of an economic recovery. So let me close with what we will learn as we move into a recovery. So first of all, as was said, we have lived experience of responding to what were prior chronic issues in the context of crisis. One of the questions that I deal with every day, and I look forward to the exchange here, is all those lessons we learned about collaboration and innovation. Are we able to translate those in the context of what we did in the pandemic in crisis into what will feel like a more chronic response? Are we going to be able to capitalize on that? As Cameron and I spoke about this morning, is this a time when we go back to our corners, or is this a time when we build on the successes of a collaboration and innovation? We have, as was mentioned before, an immense amount of data and evidence that will guide our response and how to interact with others, and particularly government. How do we leverage the awareness that has been created of the work of the community sector and its needs? Some of those things were pandemic related. Some of those things were the awakening of the challenges of racial inequities and mistreatments, and you know, sadly that happened during the period of the pandemic. But there's a lesson there that we can, or an experience there we can build on. And the community sector has demonstrated that we do have this capacity. Can we build on it? Can we add to it? One of the issues that again I spoke of with Cameron that we dealt with was around mental health. We were able to find solutions to mental health that I'm certain that will resonate with you, where we found technology solutions that spanned challenges that we had dealt with for decades, that organizations were segregated, that were operating in silos, that individuals had to go into a clinic to get a counseling session. And in the rural areas, that meant usually miles and miles and miles of difficult with the absence of no public transportation. That was replaced by technology. Now that we're returning to normal, What will the balance be between capitalizing on that technology and returning to in-person counseling? Are we going to be able to work more together? Are we going to be able to flatten and transform the work of our sector in this new reality with the lessons we have learned? Thank you very much, Sene, for giving me this opportunity, and thank you everyone for your participation and for listening.
Thank you so much, Michael. Wealth of information, and thank you as well to the folks who've uploaded resources. So I think one thing that is really coming across in all your presentations is that there are conditions that existed that predated COVID. So when we start talking about the impacts of racism or health inequities that have been developed or just underfunding of certain sectors, these are factors that predated COVID. But what you have really outlined in all your presentations today, I think, is that care work is the work of community. This is what we do. We are able to respond. We are able to respond to the issues that are coming up. And often we do that in a much more nimble way and in a way that is actually much more acceptable to community. So thank you very much. Folks, we have just 8 minutes for questions. So we will run through that very quickly. If people have questions, I invite you to add them to the chat. But perhaps while we're doing that, I will field a question to all of our panelists. Just thinking about everything that has been said today, what do you hope to see in the future in terms of collaboration between government and community organizations? Even for some of these innovations that have been developed, so for example, the community ambassadors, what future do you want to see for those innovations? I will maybe start with Gurpreet, and then we can just go down the line from there.
Well, one key thing with the community health ambassadors that we've already began the advocacy around is that from April 2022 onwards for a year, we would like to see the community health ambassadors that are deployed, which were deployed to high priority communities that were otherwise disadvantaged, that they would be able to take on additional roles. This could be around assisting with diabetes prevention. It could be around pre and post natal contacts to new families, as well as supports to those with cardiovascular disease or screening for breast cancer and colon cancer. So there's a significant number of things that community health ambassadors can do by virtue of the fact that they know how to connect to a community, are trusted now by that community, and know how to leverage resources. So that's the part with government that I think will be most interesting. And that is that as we collect evidence, as we saw Michael had, I don't imagine he collected it as evidence, but that evidence, the facts that collected around how much needs needed to be addressed, how large needs needed to be addressed, having that will now allow us, using participatory research, to make an evidence-based case to government. And many of us will not be quiet around systemic discrimination and anti-Black racism, will not be quiet. And around health inequities and problems in the education and policing systems, we will not be quiet and have found our voices. So this is something that government isn't terribly used to. They're kind of used to things slowing down and changing the flavor of the month, and something else happens and we quietly go away and wonder what happened to health equity. It won't. So please do participate with research, do participate with your your academic institutions in order to be able to build a case or enunciate the case that we need to be able to continue to remind the funders who have the responsibility for distributing our tax dollars how best they need to be spent in our communities. So I'm looking forward to that.
Thank you, Gurpreet. Amal, how about you? What do you want to see moving forward?
Gurpreet took my main point, which I mentioned before too. I think is seeing this community ambassador model and seeing where it can go in the long term. But I think speaking on that one point that Gurpreet mentioned before, as well as I think when it comes to trust building, not only between communities but also between community agencies and government, I think consistency is so important. So if I'm looking just at like a grounds level work, if we want this model to work, and if we want to ensure that community trust isn't let down, there needs to be consistency in funding, there needs to be consistency in directives, and there needs to be more of a proactive approach. So where we sit now looking at, end of March, beginning of April, being proactive in how we approach it rather than, reactive and come March saying, okay, you know what, this is a really good model, let's extend it for 6 months, maybe a year. I think really, if we want to maximize the efforts that community ambassadors on the ground can have, maximize them as kind of knowledge brokers for the community, that really comes through consistency. And so what I look forward to, not even from from a higher level, but even at an operational level, is consistency from the government when it comes to funding, when it comes to then strategy, when then it comes to operations on the ground, to make sure that the work we do is having the impact that we want and is as impactful as it could be, which every time there's a funding gap will go on halt. And then also understanding that community ambassadors are also workers, there's a level of job security, there's a level of it's not an easy job, right? You need to be a knowledge broker for so many different areas and fields, but also to also be a case manager and a friend, and then a public health expert. There's a lot of hats that you wear as a community ambassador. And so to really make that model strive, I think in the future, consistency is key.
Wonderful. Thank you so much for that. Michael, how about you? What do you want to see? You've talked a little bit about government, community relations. What do you want to see moving forward?
Yeah, so I'll say there's two things, probably at a more generic level, but nevertheless, two things that I would love to see continue. One is that data and evidence and science generally prevailed during the pandemic. It wasn't without contest. In some parts of the world, it was heavily contested. But nevertheless, I think that our political leaders, and for the most part our media, and for the most part our citizenry, really began to pay much more attention to science and evidence. That's something that the sector can also use. Those are arguments that are also helpful for us. So one, I hope that attention continues, and we will continue to use it. The second thing, though, that I think is probably as important is that along the way, we have developed some real strong allies. The relationship, and Gurpreet and Amal both spoke to it, about health equity, social justice, the social determinants of health. All of a sudden, those things became the subjects that were discussed under the same heading. That there's an alignment of our social justice issues with public health. There's an issue between our economic recovery and social justice. And so we now have allies in public health, we have allies in business, we have allies, of course, in government, and we have allies in enlightened communities. So I hope that will continue, and frankly, it will be upon us to continue to build on that allyship.
Thank you so much. Thank you so much to everyone. I will draw folks' attention to the chat. There was a question in there about the problem-solving process that United Way uses. Cameron has kindly responded on behalf of Michael. So thank you very much for that, Cameron. Maybe we'll end off with one last question. What gives you hope? What gives you hope for our sector? Amal, we'll start with you.
It's going to be small, but I think it's like Michael shared, the messages that we get from the community. I think sometimes on the ground, when you're out and you're doing outreach and someone doesn't want to talk to you, or you feel like, okay, cases are still rising, we still haven't gotten, there's still like this push, and you're on the ground, and sometimes it doesn't, you'll get a $35,000 person clinic, but then you'll get like a 20-person clinic. And right, but I think it's the messages and the feedback that we get from the community that really fuel and continue to drive the ambassadors. And I think that's what gives us hope into the future, that this works, and if we plan accordingly and we continue to collaborate, that it'll continue to work in the future.
How about you, Michael and Gurpreet?
Well, let me go first, Gurpreet, so I'm not last always, and I'm gonna lean on you. And so I agree completely with what Gurpreet said about our voices being strong and empowered now. But I would also hope that we will be self-reflective. There is a moment here where we have answered a significant call in our community, at least in our country. And I think there's an opportunity for us to build on that to be better and stronger. But it is going to require us to transform. Every other sector is transforming. The community sector is one that typically relies appropriately on consistency of delivery and support. We always need to be there. But there's a moment now where we have an opportunity to leverage this experience and self-reflect. How can we be better? How can we answer the call of our communities that are going to be demanded of us in the future? And so I hope that is a wish that is in part of this conference.
And to close, drawing from inspiration from my fellow panelists, I'm thrilled. 30 plus years in human services, and now I'm seeing the sector do something that no one else could do. I'm seeing us have reach being recognized. I'm seeing groups like ours and everyone that's attending today being felt. We will not be put back in a box, and I'm very excited about what that means going forward. And conferences like the one that is happening here at ONN have really been a good opportunity for us to hear that from each other. So that's great. And Sunny, thank you so much for leading us today.
Thank you, everyone. Thank you for this wonderful discussion. We are 1 minute over, so I will stop now. But thank you very much, everyone, for joining us. We hope you enjoy the rest of your conference. We look forward to seeing you in other sessions. Thank you very much.
Thank you.
Thank you. Thank you all.
Thank you to the panelists also. I think we can start signing off here. Thank you so much, Gurpreet. Thank you, Amal. Thank you, Cameron.
Great job, guys. That was really wonderful.